others, and then Vince and Michelle Carter
yes.
stepping up, and then other, there were other large contributors to that project too, but that was that lead donation that got things rolling. That helps our organization as we move into the future to not be solely dependent just on governmental funding in order to achieve our mission. And our mission is to provide comprehensive and the best quality of behavioral health care to everyone in our community. So it's really a great thing that Ernie's vision all those years ago, now as he's enjoying retirement, is
that come
now,
to fruition.
Exactly.
It really is.
Yeah.
And I know in terms of the need for the residential beds, even though you've said doing outreach and not really utilizing the residential, but we know that when you're trying to help a person that has a problem, having them leave you and go back into where the problem exists for a lot of them is not as much of a help as being able to remove them from that environment,
exactly
so that
right.
they can get stronger and be better able to really counteract some of what they may be dealing with out in the community.
Yeah, and that's where our partnership with Haven Recovery Center and with other sober living houses in this community, that's what's so great. Haven has just done such an incredible job of using some of the, I'm going to block on the term right now, it's a federal program to help with revitalization of distressed housing. And so Haven has been very actively involved in that, buying up properties, scattered sites across the community, and then bringing them back into the community as sober living environments and as environments where people, either with addiction or mental illness or in combination, can have safe, stable, sober housing. Literally hundreds of units now that have been created by Haven. And as a part of just our community-wide system of care, exactly what you're talking about, the ability not only to get treatment services, but also to make a change in your living environment, oftentimes is a crucial aspect of a person's recovery.
Absolutely. And in the last couple of minutes or so that we've got, you had mentioned to me that you guys are involved in this pill mill legislation and the actions that the legislature and the governor and the attorney general approved in really dealing with the issues that are involved with that, with Florida really being a major player in terms of pill mills. Share a little bit about that if you could, quickly.
Well, you got to give credit to Mary Swiderski with the Council of Governments and with Mark Jones, who heads up the Community Partnership for Children, for bringing together what we call just a substance abuse task force to address this issue of prescription drugs in our community. And it's important to note that now about 70% of our detox admissions, for example, at SMA, come as a result of people being addicted to prescription drugs. It's, whereas when I first got into this field, 70% of the admissions were for alcohol and for alcoholism. And so this is a huge problem, and it's being driven here in Florida by the fact that we're a pill mill state. We don't have we have not had a database to be able to track individuals that are going to multiple pharmacies to obtain prescriptions. And we've had this development of unscrupulous types of clinics that are in business solely to generate money by issuing prescriptions. And so Mark and Mary have brought together diverse elements of the community: treatment services, law enforcement, people who have lost family members as a result of prescription drug abuse. And we really went to work on this issue. And other similar groups to ours from around the state, we said enough of this. And then we were fortunate enough this year to have one of our very own, Dr. Frank Farmer from here in Ormond Beach, appointed as Secretary of the Department of Health. And it's the Department of Health, that ultimately is responsible for implementing this prescription drug database that had been languishing for a couple of years. It had been authorized by the legislature but never created. Well, the work got done this year to put new teeth in the law to drive these pill mills out of the state and to get this prescription drug database up and running so that it will no longer be possible for people to go from one pharmacy to the next, to the next, to the next, getting these drugs. And I'm confident that we're going to see in the next couple of years that we're going to start to get a handle on this prescription drug abuse. Now, I'm not naive enough to think that that's going to mean the end of substance abuse problems in Florida. It seems like, you know, throughout my career, there's always been something.
One thing goes and another thing.
Yeah, you know, it was, one time it was powder cocaine, then it was crack, now it's been prescription drugs. There's always likely that it's going to be something else. But we're starting to get a handle on this, and there's some good people in our community that have had a role to play in getting that done.
Well, we are grateful to you for coming on, Chet, and helping to enlighten our listening audience in terms of not only what Stewart-Marchman-ACT is doing, but also how that funding aspect plays a role, a major role, and how community leaders too coming together help to really come up with solutions to some of the issues that our citizens are facing, and that will make for a better community for us all. So this has truly been great. I truly appreciate your sharing in regards to that. We're pretty much out of time at this point.
If I could
go ahead, yes. Big said, go as long as you want.
let me give you our Access Center number and our website, because
Wonderful.
Those are ways that people can access our services 24 hours a day, 7 days a week. Our Access Center, the number there is 800-539-4228. That's 800-539-4228. And our website is SMA, for Stewart-Marchman-ACT, SMAbehavioral.org. And I want to thank you, Gwen, for having this opportunity to talk about the work that we do and to represent all the volunteers and staff at Stewart-Marchman-ACT. Thanks a lot.
Well, thank you. Chet is another one of those persons that I've known for buku years, especially from during my time when I used to serve on boards that dealt with alcohol, drug abuse, and mental health, you know, from years back. And we've really been, and not just me, but, you know, there's just a lot of people in this community that care and that understand that these problems are truly problems that impact all of us. It's not just that they impact one or two people or a person in somebody's household or whatever, but to the extent that anybody is impacted by this who is a part of our community, all of us should be helping to make a difference in that regard. And that's what's happening with Stewart-Marchman-ACT. That's what has been happening for, as has been said, you know, more than 50 years is what continues to happen, and we need to make sure that all of us really come together, band together to make this positive impactor in our community even more so, and ensure that it continues. And I'm glad that our legislative delegation is also working with us to make sure that that happens. So we thank you, Chet. And we thank Stewart-Marchman-ACT as well, and the Speedway, and all of those who are working to just make a major difference in our community. Well, the time has run out, so we just want to remind you guys again to remember to join us every Thursday.